this is Jacqueline from Lichen Sclerosus Support Network, where our mission is to empower people with lichen sclerosus by providing evidence-based education and support so that we can live in a world where those affected by lichen sclerosus are educated, informed, and get diagnosed early. If you find the information in these videos helpful, please consider donating your time or money so that we can continue our LS education and support efforts. So this is going to be my last video for 2024. It is November 2024, and I always take December off. Well, I don't really take it off because actually I use December to start working on content for the next year. So there won't be any blogs or YouTube videos from myself personally, either for LSSN or the Lost Labia Chronicles in 2024. So this is the last video of 2024. And I was kind of sitting there like, what should the last video of the year be? And I had a few thoughts and I couldn't really settle. I couldn't really decide which topic I wanted to do for the last video. And then I came across a publication by Nguyen and Kraus. Then their paper was called Vulvar Lichen Sclerosus, What's New? So essentially kind of doing a little annual recap of what's new in the world of lichen sclerosus. So I thought, well, that's perfect. Let me do a walkthrough of the findings from that paper to kind of summarize the year of vulvar lichen sclerosus research, where we're at, just kind of end on that and move us into 2025, hopefully with even more research, even more awareness, even more treatment and intervention options, etc. That's what we're going to be doing today. As always, if you like the video, be sure to give us a like. Be sure to subscribe to this channel so you don't miss any more LS content. And with that, let's jump into things. Okay, so the first topic that they look at is core outcome measures. Now, one thing that can happen and that we've seen happen in vulvar lichen sclerosus research is that we have all these different studies looking at different treatments and interventions, but these studies all use different measures to determine the success of the treatment or the intervention. Now, this becomes problematic and a bit of a challenge and obstacle because when we try to combine these results into something called a meta-analysis, we're not really able to get that kind of information that we're seeking. It's really hard to compare and put all of these studies together when they're measuring different things. So then it becomes harder to determine, is there overall consensus? Is there good evidence for this particular treatment or this particular intervention? And meta-analyses are considered to be one of the highest forms of evidence-based information. So we really do want to have more meta-analyses in vulvar lichen sclerosus so that we can have more robust, more reliable evidence backing certain, treatments and interventions. And so because all these different studies were using different measures, it was kind of hard to do this. And so to kind of fix this problem, there was a Corals team, an international team of different stakeholders that was led by Dr. Rosalind Simpson at the University of Nottingham. I myself am part of this group. And basically, this group is an international group. Like I mentioned, different stakeholders, clinicians, researchers, dermatologists, urologists, therapists, patient representatives, all over the place, right? And so we got together and the goal was to determine what are the main measures that any study on a treatment or intervention should be including in future clinical trials for vulvar lichen sclerosus. Now, what they did to figure out that consensus was they sent out a survey, a Delphi survey. This was international, and any and all stakeholders that had any kind of stake in vulvar lichen sclerosus. This wasn't just vulvar lichen sclerosus. This consensus group was for lichen sclerosus in general, right? So penile lichen sclerosus, vulvar lichen sclerosus, pediatric lichen sclerosus, all on the table. So all these different stakeholders were voting on what should be the three most important measures that we need included in future trials. And what we found was there was overall consensus, over 20 countries participated, and signs, so clinical signs, symptoms, and quality of life were the top three things that should be measured in all future trials so that we can combine those in more robust and reliable ways to determine, hey, do we have a lot of good support for this intervention, or is the support kind of weak and lacking, right? And so this is going to help clinicians with their patients determine, hey, what type of treatment should I be putting my patient on? What are the treatment options? What are the ones with strong support? What are the ones with weaker support, right? The more knowledge, the better. And so the next phase of this group, we're now looking to work to determine what instruments should be used to measure these clinical signs, symptoms, and quality of life. Should we just be doing interviews? Should we be using certain surveys? What instruments are we going to use to measure, say, the thickness of the skin? And is the skin thickness getting down to, a healthier level? Is the skin more elastic? What instruments are being used? That's the next phase. But we are working to kind of streamline research in such a way that clinicians can actually use this research in a practical way to better the lives of their patients. And I will link that paper below for anyone that does want to read, as it is open access. So you can definitely go read it if that interests you. The next topic was increased understanding of quality of life impacts. This is really, really big and really, really important. So 2024 really saw this surge where researchers were super interested in getting a deeper understanding of how vulvar lichen sclerosus affects our quality of life. Now, in the context of research, right, quality of life basically refers to how satisfied or how happy a given person is with their life as a whole, considering their physical health, mental health, level of independence, social relationships, personal benefits, and their relationship to salient features of their environment. It's a broad concept that goes beyond just the absence of disease or a certain health condition to include overall health and well-being and the ability to lead a fulfilling life. So, for example, one study looked at the association between vulvar lichen sclerosus and different psychiatric comorbidities. And what they found was in vulvar lichen sclerosus groups, there were higher levels of anxiety and depression compared to controls. Another study found that there were particular quality of life impacts in the work, social life, school domain. Again, really important to highlight this, as in most countries, we can't really get time off for vulvar lichen sclerosus, right? If our condition is flaring, we're not really able to take that time off work. So the more that we're able to show how having this condition impacts our ability to perform in a school environment, in a work environment, etc., then we can start building the cases and start petitioning to governments to get them to allow for sick leave for these conditions and allow for certain accommodations to be had. So again, really important that we have this information, really important that studies are showing, that there may be associations with higher levels of anxiety and depression in people with vulvar lichen sclerosus, again, so that our, family doctors can really check in and make sure that they're monitoring our mental health as we move through this kind of journey with vulvar lichen sclerosus. Another study looked at kind of the interconnections or interplay between shame and stigma and quality of life, right? So there's a lot of shame and stigma that comes with having a genital health condition, right? We typically don't feel shame if we have an elbow injury or a shoulder injury, or if we have, strep throat or something like that. There's not the type of shame associated with that as when these conditions affect our vulva. And so essentially this study was saying, it's likely that the shame and embarrassment that many people with vulvar lichen sclerosus feel adds to a decreased quality of life. From this paper, this is the Arnold Reese paper. I did an interview actually with Dr. Reese on this channel. I'll drop that card on one of the sides and link that below as well for anyone curious and reading a little bit more. But that paper also makes a call to really challenge and shift the societal narratives and values and how we perceive our genitals, vulvas in particular, and vulvar health conditions, so that again, we can work to reduce shame and increase quality of life. The next category is expanded disease associations. Now, this is a topic that I see getting a lot of attention in different lichen sclerosus support groups, right? So what I see is, people get diagnosed with MS and they go, huh, I have these other conditions. Is there an association between having lichen sclerosus and these conditions? Some people want to know if vulvar lichen sclerosus makes them more predisposed to developing other conditions, specifically other autoimmune conditions. So again, something that I see discussed very often in these LS support spaces. Now, previously, with the kind of literature that we had on different disease associations, what was found was that there did seem to be an association between vulvar lichen sclerosus and thyroid conditions. Specifically, Hashimoto's was the most common of the thyroid conditions. There's also alopecia areata, psoriasis, inflammatory bowel disease, rheumatoid arthritis, as well as pernicious anemia. Now, new research has also found that there may be associations between vulvar lichen sclerosus and gynecologic pain syndromes and conditions such as interstitial cystitis, some gastrointestinal diseases such as celiac disease, urinary incontinence, etc. Now, there's no for sure association with these, but they're starting to see that these conditions are higher in patients with vulvar lichen sclerosus compared to control groups, and therefore there may be an association or something there. And so this has kind of spurred new research to kind of look a little bit more deeply into these other conditions and, the potential link between the two. So again, really important that we're looking at other conditions that could be associated or not. Another study that was looking at postmenopausal people found that they had essentially altered hormones were found in the groin skin. So basically, and I'll pop an image or a video of the groin just so there's no misunderstanding of the location. So there were altered hormones in the groin of postmenopausal people with vulvar lichen sclerosus. And interestingly, most hormone levels actually normalized with steroid treatment. And then there was another study that looked at the bacterial microbiome of people with vulvar lichen sclerosus and found that there was a more altered bacterial microbiome in people with vulvar lichen sclerosus compared to controls. Now, again, both of these studies were done on very, very, very small sample sizes. So we really need a lot more research diving into these two things. But I just think that it's great and exciting that there's research being done. And we're seeing just more diversity of research, right? People are looking into the microbiome. People are looking into different hormone, aspects or potential hormonal aspects of the disease. People are looking to get a really deep and rich understanding of how our quality of life can be impacted in vulvar lichen sclerosus populations. We're looking at what are potential disease associations, what should we be watching out for? And all of these things are important, right? Of course, we want research on treatment and interventions, but we really need research in all of these areas when it comes to vulvar lichen sclerosus. So I think personally that it's a really good sign, or it's encouraging to see a more diverse approach in terms of what we're looking at when we're doing vulvar lichen sclerosus research. Now, I do want to note a quick caveat here, or maybe a couple. So a association, when we say there may be an association between vulvar lichen sclerosus and X condition, that doesn't necessarily mean that lichen sclerosus causes that other condition, right? But there's an association. We need to do more research to understand what that association is and how those two are interconnected and all the other factors at play. So a lot more needs to be done. But again, it's not saying necessarily that lichen sclerosus causes these other conditions. The other caveat that I want to stress is that just because you have vulvar lichen sclerosus does not mean that you are guaranteed to develop any of the conditions that I just listed. I myself have vulvar lichen sclerosus, and I do not have any of the other conditions that we discussed. I don't have any other autoimmune conditions. I know plenty of people that just have vulvar lichen sclerosus, and people that have vulvar lichen sclerosus and some of these conditions. It's not a guarantee, but it is important to be mindful that so we can take a proactive approach with respect to our own advocacy in the doctor's office, right? So if we know that, there are these associations with thyroid, then maybe we advocate with our healthcare provider during our annual check. Hey, can you check my thyroid? Can we run some tests? I know there's a higher association of thyroid disease with vulvar lichen sclerosus, and we can advocate better for ourselves. But again, it does not mean that you're guaranteed to get these conditions. All right, so the next topic is updates in clinical and histological variants. Now, this one was really, really important for me, or important, well, it's important, but it was very interesting is what I meant to say, for me to read through, because the way that LS or VLS is typically presented is almost as if it is this one individual unique phenomena, very clear cut. LS is this or VLS is this, right? And what current research is starting to see is that, oh, maybe it's actually not that simple as one clear phenomena. And in fact, what they're starting to discover is that there seem to be different subtypes and different variants of vulvar lichen sclerosus. And knowing that there are maybe different subtypes or are different subtypes, different variants is going to be incredibly important, because this may mean that some treatments will not work for some subtypes. Some subtypes might respond better to steroids than other subtypes, who may respond better to calcineurin inhibitors or a JAK inhibitor or some other form of treatment, right? May need different types of follow-ups, different types of management protocols. So it's really important that, we are able to understand all of these different subtypes. If you've attended the LSSN summit, you might have heard Dr. Kraft talking about, potentially, thinking that there may be different subtypes of lichen sclerosus that have kind of different symptom profiles. So again, really, really interesting. And I really do think so one of these variants is called vestibular sclerosis. So I'll pop an image up of a vulva so that we can kind of see that vestibule area, right? It's kind of below the clitoris. It's kind of home to the urethral opening, home to the vaginal opening. It's kind of got a more mucosal texture to it compared to, the labia minora, labia majora. So that vestibule is it's kind of restricted to that area. Specifically, what they're saying is that this form of lichen sclerosus only really affects one specific area near the entrance of the vagina and doesn't show usual signs of inflammation when it's examined under a microscope. Now, there's less common variants of lichen sclerosus that have been discovered, and these are non-sclerotic forms of vulvar lichen sclerosus. And this paper talks about 4 different types of non-sclerotic vulvar lichen sclerosus, and they all have their own unique features. To diagnose these correctly, doctors really need to be able to match and identify the clinical appearance with the microscopic findings. Again, it's going to be really, really important that we understand the different subtypes and variants so that we can tailor treatment and management appropriately. We always need the most clear diagnosis to get the appropriate treatment plan. So being able to identify these different types is going to be very important, I believe, moving forward when it comes to treatment and management and prognosis. So the last section is management updates. Now, one of the first things that the authors highlight here, and to be honest, I loved that they highlighted this. And what they basically said was that we need more research investigating why some people don't respond to topical corticosteroids. Specifically, they say, we really need to understand all the multifactorial, the different reasons why somebody may not respond to steroid treatment. And this is so important because I read a lot of papers on vulvar lichen sclerosus, and often we hear about steroids. They're the standard, they're very effective, they're very safe. And yes, I agree, they have the most safety and efficacy data backing them by far. We have the most robust evidence for them. We have all of these things. But the truth of the matter is, as a patient advocate who's deeply involved with and talks to so many people in the patient communities, I know that steroids just do not work for everyone. And that there's probably a bunch of different reasons why they don't work for some people. And we need more research looking into what are those reasons and what medications may be better for people that have, that kind of profile. So this, I loved that the authors called this out, and, just kind of like brainstorming, chatting with you, I was even just thinking before we were talking about the different clinical and histological variants of lichen sclerosus, there may be some variants that are going to be less responsive to steroid treatment than others, and that could potentially be one of many factors involved in, why this doesn't work for everyone, but definitely something that needs more attention, more research, and just to be highlighted in general. There was another study that looked at refractory lichen sclerosus, so lichen sclerosus that doesn't respond to gold standard topical corticosteroids treatment, for like 6 months, 6 to 12 months, they're not responding. That's called refractory lichen sclerosus. And what they found was that oral systemics, such as oral corticosteroids and then methotrexate were the most common systemics used in people with refractory lichen sclerosus. They also discuss a couple case studies where biologics were used. So biologics are essentially, in medicine, they are drugs that are made from living organisms or their products. They're used to treat various diseases by targeting specific parts of the body's immune system or other biological processes. And then there's also a bunch of ongoing trials across North America looking at the potential for JAK inhibitors or topical JAK inhibitors to be a new treatment option for lichen sclerosus. Now, these topical JAK inhibitors are not steroids. So if it turns out, and again, this is a multi-site trial, there's sites all across North America looking into this. If it shows to be safe and effective, then we potentially would have a new treatment that's even more targeted than steroids for lichen sclerosus that is non-steroidal. That's amazing, right? We want more treatment options for lichen sclerosus, again, because steroids just don't work for everyone. And if these JAK inhibitors are safe and effective and can reduce inflammation, then we may have another treatment at our disposal, another option. And options are always nice to have when you're looking at treating and managing a condition. So that one is kind of a to be continued, because we won't know the results of that until all the phases are done and the materials are analyzed, and then, the studies are published. But I'm crossing my fingers that this is going to prove to be a new successful treatment, a more targeted treatment for lichen sclerosus. So fingers crossed for that one. All right, so that wraps up each section of the paper, Vulvar Lichen Sclerosus, What's New by Nguyen and Kraus. I think it was a great way to kind of sum up all the kind of new findings from this year in a really nice, concise way. I am so thankful for each and every one of you. Thank you so much for watching our videos, for supporting LSSN, for supporting each other in the comments, in the support groups, in the membership. This is just such a beautiful community of such brave and strong and resilient and powerful people. And it's such an honor to be able to do the work that I do with LSSN and support their mission in creating a better world for people with lichen sclerosus. I am incredibly encouraged by the surge of interest in lichen sclerosus that I'm seeing at different conferences. So many researchers are taking, so much more interest in running new studies, and we're seeing such a diversity of studies. And I'm just so encouraged and hopeful that in the next, 2 to 4 years that we're going to have more treatment options, more interventions, better policies in place, earlier diagnoses, all of the things that we want. So again, I want to thank you on behalf of LSSN. I want to wish you a great and happy holiday season, and we will catch you in 2025.